Hello and welcome back to the program Challenge Diaries with Beauty Benjamin. From setbacks to comeback. Thanks for staying with us. If you're just tuning in, this is Rstv and this is Challenge Diaries. It's a program that talks about challenges, how to beat your challenges, how to come back when you've been set back, when you have fallen, and when you fall, don't stay down. Just pick up yourself, dust yourself, and say, "Look, I can do this. I can do this. I can do, and I can come out bigger." But today we're talking about health matters, health issues, and particularly for the women. Don't say because I'm not a woman, I'm a man. So I know you need it because you are a father, you are a husband, you are a brother, you are an uncle, you are a grandfather. You may have your granddaughter who is passing through this. All that. So you should have an ample knowledge about menopause so that you know how to help. Because these women need all the support, all the love they can get when passing through this process. Is a process, is a stage that no woman can escape when you are living or while you're still living. So women need all the support. And I've been talking with a doctor in the house, Dr. Highness Awiye, God's power. She's been doing justice to the topic. So you're welcome back. Let's take a ride as you connect. Doctor, welcome back.
Thank you.
We went to the brief break for news and we're back. That was news at 2 o'clock. It was at some point, I don't want to cut the conversation because I was so much enjoying it. I was relieved. And like, I had to even say, I think I don't want to be like that woman that at 77, she's still having the hot flashes and all that. Because I can just imagine what the weather is like at someone at that age. It's so discomforting and you'll be like, I can imagine how irritable she will be and all that. So, let's continue. Now we'll talk about all the symptoms, the signs and all that. And if we cannot beat them, we cannot, there's no duration to how this thing can go on. Now let's look at the health part of it, the healthy living. Can someone passing through or experiencing this process of menopause, can you have a healthy life? Because you talk about the fragility of the bones, you're talking about the irritability, you're talking about it's the psychology, everything. It's like it's a total, package. Now, let's talk about the health part of it. Can you actually have menopause and still have a healthy life?
Of course.
Okay.
Of course, you can live a healthy life. Now, one way to also, you need to also talk to yourself, as in psychotherapy I'm talking about. You need to talk to yourself. It's a natural process that every woman passes through. It's not a disease condition.
Yeah.
All right. It's a natural process. So once you do tell yourself that this thing is a natural thing, it also helps to down some of the symptoms that you look as if they are magnified, right? So that's one way to also, you have to talk to yourself that, oh, this thing I'm passing through is natural, that most women pass through, almost every woman pass through. Okay, then maybe to a certain degree. But if the symptoms are so much, now one way to also help yourself is doing exercises. Can do exercises, to drink a lot of water, healthy living. One way to do this is to take a lot of fruits and vegetables, eat healthy. Okay. It can also help you to live a normal, life. Exercises, drinking a lot of water. Sometimes when you have that hot flushes and you feel that there is this excuses, you take a lot of water and drink it, and then it calms down. It can just
for that moment.
Yes, so drinking a lot of water also helps. And then also, you can also, if the symptoms are so much, you cannot, I advocate that if they are not so much, the ideal thing to do is to actually, talk to yourself and then manage it as it comes. Now, there are non-hormonal drugs and then hormonal drugs that you can use to manage this.
Okay.
The non-hormonal drugs, like chloroquine and gabapentin, can also reduce this hot flushes, because there's one of the challenges with menopause is this hot flushes.
Hot flushes, yeah.
People
it comes in form of sweat, right?
Yes, and then sometimes the vaginal dryness, irritation, itching, and all that. It's as a result of it's one of the part of the menopausal signs that your symptoms that you can see. Okay. So sometimes you may need to use estrogen cream. Locally apply it to the vagina. It can also relieve those dryness and those symptoms for the woman that is having issues with that. And then the hormonal ones that are called, like I mentioned, estrogen. Right, but bearing in mind that these drugs, they also come with their side effects.
Yeah.
You understand? Even like the clonidine and the gabapentin I mentioned, that can also reduce the hot flushes, the vasomotor symptoms, the irritability and all that. They also come down. They also have there's no drug that does not have side effects. So it's all to you to look at the side effects of these drugs and then see whether you can manage with them. But it's not good for you to go and start purchasing these drugs. But I said you need to see a gynecologist, specialist, and then complain about what. And then for your complaints, sometimes when they talk to you, counsel you, find out that you can cope with it. There's no need for you to start panicking. It's a natural process. Okay. So there's no panic about that. It's not a disease condition, but it comes with these symptoms because. See, these symptoms can be unbearable sometimes. When it's unbearable, you need to, engage in services of the gynecologist.
Okay, so are there things that one need to not to do? Now, when you get to this particular age, are there certain things you should abstain from, or certain things you should practice to do?
Okay, like for instance, when you are talking about menopause, the bone density things, and then you can get fractures. But there are things that you need to be conscious when you're going to the bathroom, sleeping floors and all that, climbing stairs, climbing
stories.
No, you can't climb.
Okay.
So it's part
but
of
careful
exercise.
when you're climbing.
Yes, you have to be careful when
cautious.
You have to be cautious. Because if you fall, as a woman, once you enter you fall, when you are younger, maybe you won't fracture a bone, but any small fall, you can have a fracture.
Okay.
Right. So that's one thing that you have to be conscious of the environment. We are going to somewhere where even wearing two heely shoes when you are advancing, it's not so good. It can also, be inconveniencing. Sometimes you can trip over and then when you fall, you can have a fracture. So these are the things that you have to be cautious about. But otherwise, you can live a normal life. Yes, you can do exercises, having a healthy lifestyle, eating food, taking a lot of food, vegetables and all that, can also can help to improve your symptoms. Okay. Exercises, drinking a lot of water, all that.
But those exercises, it will vary.
Yeah, it's not very vigorous exercises. Sometimes brisk walk.
Okay.
Right? Sometimes all these, there are exercises that, if you look at, there are some exercises that you may need to do as you are advancing in age. When you are advancing, there are some very strenuous exercises that you shouldn't do.
Yeah.
Because you can actually do that, you can have a fracture.
Yeah.
Right? So these are things you need to do. Stretch exercises, brisk walk, maybe walk out, just go around, walk for, just normal walking, and also help. To reduce when you are feeling those symptoms, your walking itself, you can help to any morning exercises can help to reduce those symptoms.
I'm constrained. There's a question that is in my mind that I want to ask, but I'm so constrained, and I'm looking for the right word to use now. In the case of a couple, there is a myth that during menopause, the woman tends to have reduced interest.
Yes, that's one of the libido.
Yeah.
There's reduced libido.
Okay.
Right? In sexual coitus or sexual. But now the thing is that it's not just for women alone.
Okay.
It goes across whether the man or the woman.
Oh, really?
As they are advancing in age, libido, the ability to have the urge for intercourse reduces. It's not just for women, for the women, but even for the men.
Okay.
Right? So sometimes when it happens, you need to, and then most of the time, apart from the libido reducing, there is also because of the vaginal dryness, and then any small thing that happens there can have a tear. It's brittle can have a tear. So with that, we need to also talk about that's where the estrogen comes in into play. So
okay.
If you are still having engaged the menopause does not mean that you should stop having intercourse.
Because I know a couple that it's been like a tearing issue between them. And that's what, like, when we started the second segment of the program, I was saying the women needs support of the men. Because when you're passing through this process and you don't have support, now the man does not understand what she doesn't understand what he's passing through, and it's like, make for crying out, you're complaining, you're whining, you're nagging. What is it? Are you the first one who are? And like we said here, it happens to people have their different experiences. What she was going through was something that, yeah, she was irritable. She was so discomforting. And I was like, I mean, I don't understand. What's this thing? It's like you're pretending. And she's, look, I'm not interested. I don't have interest. I don't have. And you're like, you're lying. And they had serious fracas. You know that, if not that, it cannot, because of the Christian life, people had to, it could have broken the marriage. So, if a woman is passing through this stage, I think not just the man, everyone around her should give her full support.
Of course, and then sometimes you need to go for the whole counseling, the couple.
Okay.
Right? You know, because most of the times the men does not know that that is what the woman is passing through.
Yeah.
That is the essence of discussing it, you know. Until you know, as a couple, when you are passing through challenges, you have to sit down and discuss it. You know, the communication is the key. You need to learn it, because sometimes even when you communicate, you may not be able to understand. So counseling, you can go to see the psychologist, and then counseling can help. But then even then, by and large, if the woman can get this people can help, there is no way to increase the libido.
It will not.
For the men as well.
Okay.
The man is aging in their 40s, late 40s, 50s. The libido reduces as well. It's not every time a man.
Maybe that is why there's a lot of craving for drinks and things to enhance the which is not good. Okay.
It comes with its own challenges.
I have a friend who had a surgery about 7 years now. She did an extractomy. 7 years down the line now, and he's been having this complaint, and I'm like, don't you think it's part of it? Maybe you should see a doctor. And I said, no, I'm too young, I can't be. I'm not think. I'm saying she's in late 40s.
Okay, so
and she had the surgery in 2018, about 7 years now.
Okay, the surgery is not what is causing it, really, because if you take out the womb, then you said that she had this treatment, and they remove the womb.
Yes.
And if they remove the womb and the ovaries are there, okay, she may not just enter menopause. Alright? And then the only thing that she will not be seeing nurses.
Yeah, she's not.
Because the womb is gone.
She's not, she's not. And then she's having all of the symptoms. You mentioned the dryness, all that.
Because she's approaching a menopause from what we are talking about at her age. It's not because they remove the womb.
Okay.
Right? Yes.
So that does not have anything to do with it.
Yes, if they remove only the womb removal, depending on age. If it was removed around in her late 40s, I think they will need to take out the ovaries as well because of the risk of ovarian cancer. They're afraid.
I think the womb was moved around maybe 41 or 40.
Okay, so if she was 41 or 40, they will leave the ovaries. So at that time, she will not be having those symptoms, I'm sure, if you ask her. Then this one, that she's almost like 49, and she's going towards a menopause. So she will definitely have the symptoms that we're talking about.
So the answer now is to see a doctor or to manage it or expect it.
You have to expect it. Every woman must expect that you.
But I don't know now if we have 100 women. I don't know a percentage of women that don't experience this.
They mean the menopausal symptoms.
Yes.
If you don't experience one, you will experience the other. There are so many. So there's no way you will not experience one thing.
Is there another one after this menopause that you want to experience?
What I'm saying, the symptoms are
okay.
So even if you don't have, you may even have the central nervous system there's your forgetful, okay, you're not lack of concentration, even weakness, all those things that comes with it. The fact that you're not having severe form of hot flushes does not mean that you're not having other problems. Alright, so one way or the other you have them because of the dwindling of the estrogen or the months of the woman. Right?
There's a myth around it that you know why I always talk about social media, because people dump everything on social media, and so we look at it and then we pick out and we try to talk about it and discuss it and get the fact out of it. There's a myth around it that people begin to experience loss of hair in their edges.
Yes,
now.
yes, that's one of the problems. Okay, I forgot to say that.
Really?
Yes, it's one of the, because the hair becomes brittle and then it starts begin to regress. Right?
So
Loss of hair is one of the problems of menopause.
So is there something that a woman does not experience in the course of menopause? Is that something that you say, okay, like when a woman is pregnant, and then certain people, they cannot stand the perfume, they cannot eat certain food, they cannot do that, and all of the can't do.
So
but when they that things that it's not associated with this menopause, other things like that.
No, not really. It's just that it just comes. It's things that comes with it. So there's nothing you can do about it. You have to experience it. All right.
And there is no escape route for it at all.
There is no escape route for it. Now, the only escape route that it's not. So there are some that they have the way with. For instance, that your friend that they've removed her womb. She can actually go for hormone replacement therapy, like I said. Hormonal drugs, yes.
Okay.
Giving, yes, low dose estrogens. Right, it can also help with some of the symptoms that even especially the vaginal dryness and the pain and discomfort during intercourse and all that.
But those hormonal drugs, don't they have side effects?
That's what I'm saying.
That's a thing.
Almost all the drugs, any drug you take, have the only side effects.
We don't want to talk about herbal drugs because then we know how that one is. That one you won't even talk about.
No. I don't say no.
It's a no way.
Because some of these drugs we're looking at because for you to give drugs to people, you need to know their side effects, which is very important. Because if you look at the woman and then she has some other problems, like she's hypertensive, then she's diabetic and all that. There are some drugs that you wouldn't want to give that kind of woman because it's going to worsen her situation. Because they already have, if taking those drugs already increases the risk of cardiovascular problems, heart disease. And it's one of the problems of women that have, that enter, even heart diseases increases the risk of heart disease when they enter the menopause. Alright, so these are the problems. So, but if the symptoms are so severe that you cannot manage them, the ideal thing to do is to see the gynecologist and then you look at you holistically and then decide whether you merit hormone replacement or not.
Okay.
Any of the non-hormonal drugs.
It's been interesting talking to you. Like the title of this program is Challenge Diaries. And then I don't want to let you go until you tell me a challenge you've experienced that you overcame. Now, you are a doctor, a consultant, you are a lecturer, you are a mother, you are a wife, you are everything. I mean, it's wow. Now, what is that one challenge that you've experienced in this process you've been through and you overcame it, you stood out, you say, look, I can beat my chest, I did it, as well, I'm here. I can say, Challenge Diaries, I did it. You can also do it.
Alright, is trying to combine as a woman, the vacuum, combining your role as a wife and as a mother, and then trying to become who you desire to be. It's quite challenging.
Lots.
Because sometimes you just come back home and you're going straight to the kitchen to go and sort out, especially maybe if the people around you are not really that so you just come down, just drop your bag and you're into the kitchen straight to go and cook. And
you have students that will be calling you. You have patients that will be calling you.
Of course, your lines are open 24 hours as a medical doctor. So these are the challenges. But one thing is that when you set your mind on something and you have that desire to achieve it, you can achieve it. It does not matter how difficult it is, you'll be able to achieve it.
Doctor, thank you so much. I've enjoyed this session so much. I appreciate your time for coming here, doing this with us. I want to beg you that maybe next time when we call you, please oblige us to come. I'm glad that Rivers people and everybody watching us, but this is on YouTube, it's being streamed, people are watching. You've gotten something today, and then if you've done that, please give us a like, give us a comment, subscribe to the channel. Let's hear your view. I mean, your views can just help us to do better. Thank you so much for having me, Doctor. I'm glad to do that. You've been watching Challenge Diaries. From setbacks to comeback. What are your challenges? How did you beat them? How did you come back? You want to talk about it? Just see me in the DM. I will talk about it. My name is Beauty Benjamin. Thank you. Same station next time.